You wake up in the middle of the night, or maybe it is first thing in the morning, and your mouth feels like someone stuffed it with cotton. Your lips are stuck to your teeth, your tongue feels thick and rough. You reach for your water glass before you even open your eyes all the way. You take a sip, feel better for a moment, and then think absolutely nothing of it. You chalk it up to sleeping with your mouth open, or maybe you had salty food the night before, or maybe it just happens sometimes. So you get up, start your day, and forget about it completely. But here is what most people never find out. That dry, uncomfortable feeling you dismissed in about 30 seconds could actually be one of the earliest warning signs your body sends you before something much more serious develops. And the frustrating part is that doctors rarely bring it up unless you specifically ask. In fact, research shows that millions of Americans experience chronic dry mouth on a regular basis, and the overwhelming majority never connected to anything beyond simple dehydration. But as you are going to find out in the next few minutes, dry mouth is not just uncomfortable. It can be a signal, a clue your body is sending you every single morning, and learning to read that clue might be one of the most important health decisions you make this year. So let us start at the very beginning, because to understand why dry mouth matters so much, you first need to understand what saliva actually does. Most people think of saliva as just something your mouth makes to help you chew and swallow food, and yes, it absolutely does that. But saliva is doing so much more than you realize, almost every second of every day. Saliva is packed with proteins, enzymes, and minerals that form a protective coating over every surface inside your mouth. It neutralizes acids that would otherwise slowly dissolve your tooth enamel. It kills harmful bacteria before they can travel deeper into your body. It carries oxygen to your gum tissue to keep it healthy and alive. It washes away food particles that bacteria would otherwise feed on. And perhaps most importantly, it plays a direct role in your immune defense, containing antibodies that help your body fight off viruses and pathogens before they even reach your throat. When your salivary glands are working the way they should, they produce between 1 and 1.5 liters of saliva every single day. That is an enormous amount of protective fluid working quietly in the background to keep you healthy. So when that system is disrupted, when your body starts consistently producing less saliva than it should, the consequences are not small, and they do not stay limited to your mouth. Now you might be wondering, okay, but does not everyone wake up with a dry mouth sometimes? And the answer is yes, occasionally and mildly. That is completely normal. Your saliva production naturally slows down while you sleep. That is just biology. But there is a very important difference between mild morning dryness that clears up within minutes of drinking some water and staying hydrated through the day, and persistent or frequent dry mouth that keeps coming back, feels severe, or is accompanied by other symptoms. That second pattern is where things get interesting and where your body is trying to tell you something specific. One of the most common and most underdiagnosed causes of chronic dry mouth is a condition called sleep apnea, and this is where things get serious very quickly. Sleep apnea is a condition where your airway partially or fully collapses while you are asleep, causing you to briefly stop breathing, sometimes dozens or even hundreds of times per night. Most people who have it have absolutely no idea. They go to bed, they fall asleep, they wake up in the morning feeling tired even after a full night, and they might notice their mouth is dry. What they do not realize is that during those pauses in breathing, their body switches to breathing through the mouth, which rapidly dries out all the tissues inside. The dry mouth is not the disease, it is the footprint the disease leaves behind. According to sleep research, obstructive sleep apnea affects roughly 30 million adults in the United States alone, and estimates suggest that around 80% of moderate to severe cases remain undiagnosed. That is tens of millions of people waking up every morning with a dry mouth and no idea that their heart, brain, and blood pressure are being quietly damaged while they sleep. Untreated sleep apnea has been directly linked to significantly higher risk of high blood pressure, heart attack, stroke, type 2 diabetes, and cognitive decline. So if your dry mouth is accompanied by snoring, waking up feeling exhausted no matter how long you slept, morning headaches, or your partner telling you that you stop breathing in your sleep, that combination of symptoms deserves immediate medical attention. Not tomorrow, not next month, but genuinely soon. But sleep apnea is only one piece of this puzzle, and here is where it gets even more layered. Another major cause of chronic dry mouth that is rarely discussed openly is medication, and this is something that affects an enormous number of people, especially adults over the age of 50. There are over 500 commonly prescribed medications that list dry mouth as a side effect, over 500. That list includes antihistamines, which are in almost every allergy and cold medicine you can buy off the shelf, blood pressure medications, antidepressants, anxiety medications, diuretics, muscle relaxants, and many of the medications used to treat overactive bladder, Parkinson's disease, and even high cholesterol. What happens is that many of these drugs interfere with the nervous system signals that tell your salivary glands to produce saliva. The glands are perfectly healthy, but they stop receiving the message to do their job. And the insidious part of this is that most people are never told this could happen. They get their prescription, maybe glance at the pamphlet, see a long list of side effects in tiny print, and move on. Then, months later, they are waking up every morning with a dry mouth and have no idea why. If you are taking any regular medication and experiencing chronic dry mouth, the very first thing you should do is bring it up with your doctor. Sometimes a simple dosage adjustment or switching to a different medication in the same class can make a significant difference. This is not about stopping your medication on your own. It is about having an informed conversation. Now, there is something else happening beneath the surface with chronic dry mouth that very few people talk about, and it is frankly one of the more alarming aspects of this whole picture. When your mouth stays dry for extended periods, you create the perfect environment for harmful bacteria to thrive. Saliva's job, among many things, is to keep the bacterial population in your mouth balanced. Without enough of it, certain strains of bacteria that are normally kept in check begin to multiply rapidly. The most well-known consequence of this is tooth decay and gum disease. Studies have shown that people with chronic dry mouth develop cavities at significantly higher rates than the general population, and their gum disease tends to be more severe and progress more quickly. But here is the part that extends far beyond your dental health. The bacteria that grow in an unhealthy mouth do not stay there. Research over the past 2 decades has revealed strong connections between chronic oral bacterial imbalance and systemic health conditions, including cardiovascular disease, diabetes complications, respiratory infections, and even dementia. There is a specific bacterium associated with gum disease called Porphyromonas gingivalis that has been found inside the brains of people with Alzheimer's disease, inside the arterial plaques of people with heart disease, and in the bloodstreams of people experiencing diabetic complications. Your mouth is not a sealed compartment. It is connected to everything. And when chronic dry mouth allows the bacterial environment there to become imbalanced over months and years, the downstream effects can be profound. That is not meant to scare you unnecessarily. It is meant to help you understand why something as seemingly small as a dry mouth in the morning genuinely warrants your attention. Let us talk for a moment about diabetes, because the relationship between dry mouth and blood sugar is something every person should understand, whether they have been diagnosed or not. One of the hallmark early symptoms of both type 1 and type 2 diabetes is excessive thirst and dry mouth. When blood sugar levels are elevated, your kidneys work overtime to filter and flush out the excess glucose, and this process causes significant fluid loss. Your tissues become dehydrated, your salivary glands do not have enough fluid to work with, and your mouth becomes chronically dry. For people who have not yet been diagnosed with diabetes, this dry mouth can sometimes be one of the first noticeable signals that something is off with their blood sugar regulation. And here is the added layer. Diabetes itself further impairs salivary gland function over time, creating a feedback loop where dry mouth worsens as blood sugar control becomes more difficult. If your dry mouth is combined with increased thirst throughout the day, frequent urination, unexplained fatigue, or blurry vision, please speak to your doctor about getting a simple blood sugar test. It is fast, it is inexpensive, and catching diabetes early makes an enormous difference in outcomes. There is also a less commonly known condition called Sjogren's syndrome that deserves mention here, because it is significantly underdiagnosed, particularly in women. Sjogren's is an autoimmune disease where the immune system mistakenly attacks the body's moisture-producing glands, the salivary glands and tear glands primarily, though it can also affect joints, kidneys, nerves, and other organs. The classic presentation is persistent dry mouth and dry eyes together. The average time between the first appearance of symptoms and an actual diagnosis of Sjogren's syndrome is estimated to be around 6 years. 6 years of people being told they are just dehydrated, or that they need eye drops, or that it is just a side effect of something else. If you regularly experience both dry mouth and dry, gritty, irritated eyes, particularly if you also notice joint pain or unusual fatigue, that combination is worth specifically mentioning to your doctor and asking whether Sjogren's should be ruled out. Now let us get practical, because understanding what dry mouth can signal is valuable, but knowing what you can actually do about it is equally important. The first and most basic step is to be genuinely honest with yourself about your hydration. Most adults in the United States consume far less water than their bodies actually need. The common recommendation of 8 glasses a day is actually a rough minimum, not a generous target. Alcohol, caffeine, and high-sodium foods all increase fluid loss, and many people do not compensate adequately. If you are regularly waking up with dry mouth, and you are also someone who drinks coffee throughout the day, has a few alcoholic drinks several nights a week, and does not drink much plain water, addressing hydration alone might make a meaningful difference. Beyond hydration, there are several things that can help manage dry mouth while you and your doctor work to identify and address the root cause. Staying well hydrated throughout the day is foundational. Breathing through your nose rather than your mouth, both during the day and while sleeping, significantly reduces moisture loss. Avoiding tobacco in all forms is critical, because tobacco directly damages salivary gland function and dramatically worsens dry mouth. Limiting alcohol and caffeine, especially in the evening, helps as well. Over-the-counter saliva substitutes and mouth sprays can provide relief, and some people find that chewing sugar-free gum stimulates saliva production enough to be genuinely helpful throughout the day. There are also prescription medications that can stimulate salivary gland output in cases where the glands themselves are still functional but underperforming. Your doctor or dentist can discuss whether those might be appropriate for your situation. Your dentist, by the way, is often the first healthcare provider to notice the signs of chronic dry mouth before you even bring it up. Increased tooth decay, particularly in unusual locations like the root surfaces or the bottom edges of teeth, is a telltale sign. If your dentist mentions that your teeth are showing unusual patterns of decay or that your gums look inflamed, connecting that observation to your experience of dry mouth can open up an important diagnostic conversation. Do not hesitate to be specific with your dentist about what you are experiencing at home, when it happens, how severe it is, what medications you take, and whether it has been getting worse over time. Here is something important to keep in mind about all of this. The body is extraordinarily good at communicating when something is wrong, but it often communicates through symptoms that feel minor, annoying, or easily dismissed. A dry mouth in the morning feels like a trivial inconvenience. It does not feel like a warning sign. It does not feel like something connected to your heart, your blood pressure, your blood sugar, or your immune system. But that disconnect between how minor a symptom feels and how significant its underlying cause might be is exactly why so many serious conditions go unrecognized for years. The people who stay ahead of their health are not the ones who panic about every small symptom. They are the ones who pay attention, who notice patterns, who know which seemingly small signals are worth taking seriously, and who bring those observations to their healthcare providers with the right questions. So here is what I would ask you to do with what you have learned today. For the next 2 weeks, pay attention. Notice how often you wake up with dry mouth. Notice whether it is mild and gone quickly, or whether it lingers and keeps coming back. Notice whether it is associated with other symptoms: fatigue, headaches, thirst throughout the day, dry eyes, or anything else that feels out of the ordinary. Write it down if that helps. And if the pattern is consistent and significant, bring it up at your next doctor or dentist appointment as a specific concern, not just as an aside. You deserve a healthcare provider who takes that observation seriously and helps you investigate it properly. Now I want to hear from you because your experience and perspective genuinely matter here. Have you dealt with chronic dry mouth? Did it turn out to be connected to a medication you were taking, or to sleep apnea, or to something else entirely? Or maybe you have a family member whose dry mouth ended up being an early sign of something that was later diagnosed. Whatever your experience is, sharing it in the comments below could help someone else who is watching this video right now and wondering whether what they are experiencing is worth paying attention to. Drop your story below. And if you found this information valuable, please share this video with someone you care about: a parent, a spouse, a friend who might be dismissing a symptom just like this one. Sometimes a single piece of information at the right moment changes everything. Take good care of yourself, stay curious about what your body is telling you, and I will see you in the next one.